Hi there. Today we're going to look at the heart and why it is super important, how it nourishes itself, the parts of the heart. We're going to look at different types of circulation, and then we're going to also look at things that we can measure about the heart so we can know if we're healthy or not. So let's get started. All right, this is your heart, and these are all the blood vessels that are associated with the heart as well. So let's go over the different parts. First of all, we have the epicardium, which we have seen that epi means the outer layer. So this is the epicardium. The middle layer, or the myocardium, is named myocardium because it's made of muscle, that cardiac muscle tissue. And then the endocardium is made of smooth endothelial tissue that is very slick to allow for blood flow to flow easily. And then we also have the apex of the heart, and the apex for most people is going to point to the lower left hip. For some people that have the genetic disorder situs inversus, it'll actually be flipped, and there's some complications with that, so we can discuss that in class. If I look at this picture, you should notice that you have various chambers within the heart, okay? You should also notice that one side is blue and one side is red. Now, is it really red and blue? No, but in general, that's how we describe the right and the left side. But when we have our heart practical, you're going to need to be able to tell the difference between the right and left side based on some other characteristics that I'm going to tell you that we will see in lab. So you have two receiving chambers. The atria, you have one on the right and one on the left. You also have two discharging chambers, one on the right and one on the left. The right atrium is going to receive deoxygenated blood from the vena cava. The left atrium is going to receive oxygenated blood from your lungs. Each of these is going to and they're not very muscular compared to the ventricles, but they're going to push the blood through to the ventricles. The right atrium goes to the right ventricle, left atrium goes to the left ventricle. The right and left ventricles are called discharging chambers because they push blood out of the body, or out of the heart to the rest of the body. The right ventricles, because this is deoxygenated blood, we need to pick up oxygen, so it's going to push the blood to the lungs. When the blood gets oxygenated, it comes into the left atrium, down to the left ventricle, and since all that oxygen needs to get to the rest of our body, it's pumped to the rest of the body from the left ventricle. Now, your heart requires a lot of oxygen and a lot of nutrients because it never, ever rests, and the cells don't generally replace themselves. And so you'll notice you have coronary arteries. If these become clogged, you can have myocardial infarctions, which is a fancy word for a heart attack. And then you also have cardiac veins that are going to drain that deoxygenated blood and empty it back into your right atrium. Now, the major blood vessels that you're going to need to know that are coming from the heart are your vena cava. You have the superior vena cava. Let's see if it'll pump up. You also have, here's the superior vena cava right here. You also have the inferior vena cava, and these are going to bring deoxygenated blood to the right atrium. Now, when the deoxygenated blood goes from the right atrium to the right ventricle, it has to be pumped out, and it's going to be pumped out through the pulmonary artery. Now, most people think that arteries are going to carry oxygenated blood, but this is an example of when that is not true. What you need to know is arteries always away from the heart. Arteries always away. So the pulmonary artery is pumping blood away from the heart to the lungs to pick up oxygen. When it's picked up oxygen, it sends the blood through the pulmonary veins into the left atrium. That left atrium then pumps it down to the left ventricle and out into your major, huge, important blood vessel called the aorta. Now, we will talk about these branches from the aorta later, okay? All right, so what prohibits when these ventricles are so muscular and powerful, when they pump, what prohibits that blood from going back up into the atria. And it's valves that do this. You have semilunar valves, the pulmonary semilunar valve and the aortic semilunar valve. Pulmonary because it's heading towards the pulmonary artery. Aortic because it's heading towards the aorta. And then you have atrioventricular valves, the tricuspid and bicuspid. Remember, tri, right. Bicuspid is also called the mitral valve, and so that's on the left. Mitral has an L in it, like left does. If I want to look at why they are named tricuspid and bicuspid and semilunar, so here's semilunar, the reason why right here. Here's your pulmonary. You'll always find this in the front of the heart ahead of the aorta. So here's the pulmonary semilunar valve, aortic semilunar valve. Here's the tricuspid because it has 3 flaps, and the bicuspid because it has 2 flaps. Now if you have a murmur, you have an issue with the blood moving into the wrong area. Those flaps aren't working correctly. And a lot of people have murmurs, and some of them aren't too bad, and some of them are pretty bad. So you gotta, if your doctor says get your heart murmur checked out, you need to get it checked out. All right, so let's look at the difference between the 2 circuits of blood. Notice on this animation on your left that it's showing you that the atria pump at the same time, the ventricles pump at the same time, and so you'll hear a lub-dub, which we'll talk about in a second. If we come over here, what you'll notice is that this represents your pulmonary circuit, this represents your systemic circuit. You have many, 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 many blood vessels, and we'll review some of them in class or in another lecture, but this is kind of like a basic diagram. The pulmonary circuit is going to start with your right atrium, right ventricle, go out through your pulmonary artery to your lungs. We have our pulmonary veins, and then to our left atrium. That's the pulmonary circuit. The whole point of the pulmonary circuit is to pick up oxygen. And whenever I pick up oxygen, I can go through the systemic circuit. So starting at the right or left atrium, I have left atrium, left ventricle, aorta, rest of the body, all throughout the body, and I'm bringing deoxygenated blood back to the right atrium. So the systemic circuit, the whole point of it is to deliver oxygen to the tissues that need them. Okay, so pulmonary circuit to pick up oxygen, get rid of carbon dioxide. Systemic circuit to deliver that oxygen and pick up all of the waste carbon dioxide. So you do need to know the difference between the 2. All right, so let's look at some ways that we can measure how efficiently our heart is working. One of those ways is by looking at the electrical activity of the heart. It's very important that our electrical system in the heart is working, and it actually has its own electrical system working. It doesn't necessarily rely on the brain, although the brain does help in looking at how quickly the heart needs to beat. But we need to look at this real quick. The SA node is called the pacemaker of the heart, and it's located in your right atrium. When it sends an impulse, it sends it to the AV node, or the atrioventricular node, that's located right here between your right and left atria, right before it gets to your ventricle. Then it goes to the bundle of His, or bundle, and then the branches, and then the Purkinje fibers. The Purkinje fibers are going to cause a contraction of your ventricles. So your SA node going to your AV node causes your atria to contract. Going from AV bundle of His, bundle branches, and Purkinje fibers is going to cause your ventricles to contract. And we're going to go over a chant in class to help you remember the order. Now, some other measurements that we can take is your heart rate. You can do that by feeling for a pulse, and that's by palpating it. Or you can hear it with a stethoscope. The stethoscope is the thing that the doctor puts, or the nurse puts in their ears, and they put the little thing on the hearing thing. I can't think right now, but the little pad on your chest, sometimes on your back. But normally, when we are at rest, our heart rate can range from 60 to 100 beats. Generally, the more exercise you get, the lower your heart rate is going to be, because your heart doesn't have to beat as often to get oxygen to where it needs to go, because your heart actually hypertrophies or gets a little bit bigger so it can pump more blood out per pump. Now, we do see that during exercise your heart rate will increase because your demand for oxygen also increases. For people that are healthy and fit, it doesn't take very long for their heart rate to return back to normal. The less fit you are, the longer it takes, and that's a general statement, the longer it takes for your heart rate to go back to normal. Another thing that we can do is take our blood pressure with a actually let me show you your pulse points. You have a carotid artery in the neck. You can feel for your brachial, radial, and ulnar arteries. Femoral is here in this inguinal region, behind the knee and the popliteal, posterior tibial, and then your dorsal pedis. And sometimes, depending on, if you've had damage to a particular area, they can feel on any of these areas to get a pulse. But blood pressure is taken with a tool called a sphygmomanometer, and you can palpate the beating or listen to the beating of the heart using a stethoscope. And what's very cool about this is what happens is when you're normal, your blood is going to move through your arm or any other body part, and generally we use the arm, and this is your brachial artery. Well, a sphygmomanometer will actually close or pinch that brachial artery so blood can't flow to it. And we usually go to about 140. Sometimes if someone has high blood pressure, we can go higher than that, but it's basically when you don't hear any sounds, and your stethoscope would be placed right here in this region of the antecubital region of your arm. You would slowly then release pressure from the bulb, and that would cause blood to flow. Once you hear a sound, that would be what's called your systolic pressure. And when you no longer hear a sound because your blood isn't having to fight to get or cause a lot of pressure to get to your arm anymore, that is your diastolic pressure. In general, 120/70 is seen as a normal blood pressure, but your blood pressure can range, your systolic, anywhere from 100 to 140. 120 again is kind of average. If you're over 120, they would consider that pre-hypertension. If you're over 140 though, you would be a hypertensive patient, so that's definitely not good. Your diastolic, and this systolic is when your heart is contracting. That's the amount of pressure in your heart. For diastolic, your heart is at rest. That's the amount of pressure, and so you don't want a high amount of pressure, but you do want some pressure. And so below 80 is going to be normal. I've seen it range from, mine sometimes can be below 60 for my diastolic pressure. But if you have hypertension, it would definitely be 90 or above. All right, well, we will discuss some more of this in class, and I hope you've enjoyed this lecture.